Hi everyone, my name's Bethan and I'm one of the physiotherapists at Velindre Cancer Centre. Today I'm going to talk a little bit about physical activity after your cancer diagnosis. In today's talk we're going to talk about physical activity in cancer, the headlines, so we're going to look a little bit about what the evidence actually says. We'll talk about the benefits of physical activity. We'll also talk about the different types of physical activity. We'll also look at the guidelines, so look at how much we should all be doing and how much is actually enough. We'll also look at the role of the pelvic floor strengthening exercises, and then we'll finish with some top tips for physical activity. So before we begin, I'm just going to talk you through some of the things that we hear from our patients when we start talking about physical activity after a cancer diagnosis. Some of these things might ring true to you, and that's okay if they do. It's totally normal to have some negative thoughts or challenges when you start thinking about something like this. So some of the things that we often hear from our patients are things like, I'm afraid to start exercising. Some people are worried that they could do harm or damage when being more active. I don't know where to start. I was active before. Am I able to get back to this? I don't have the energy or the willpower to exercise. I don't know how to balance exercise with my work and home commitments. It's too late to start exercising. Now, one key take-home message from today is that it's never too late to exercise or be physically active in order to get the benefits. And hopefully this presentation will give you a little bit more information and hopefully some confidence to start becoming a little bit more active to help you get those health benefits. So, physical activity in cancer, the headlines. We'll look a little bit now about what the evidence actually says. And what we know is that it's beneficial for patients at all stages of the cancer care pathway. This means it's safe to do during and after cancer treatments and can benefit you at all stages. It can help to manage treatment-related side effects, and we're going to look a little bit more about this in the next couple of slides. It helps to improve function after treatment. So what we know is that people who maintain a level of activity during treatment recover more quickly and actually maintain a functional level after treatment. And it can also help to manage other long-term health conditions such as heart disease, diabetes, reduce the risk of stroke. Physical activity can also benefit these things. So let's look a little bit more now about the benefits of physical activity in the general population, really. So some of the physical benefits that you may or may not already know about are that being active to the recommended levels can help to manage weight, especially when undergoing treatment, because we know that weight can fluctuate as you undergo through certain treatments. It can help to improve heart health. So the heart is a muscle, just like any other muscle. So the more we work it and challenge it, the stronger it will get. It can help to improve strength and stamina. So when we're active, it helps to challenge our muscles and make our muscles work efficiently in order to help build endurance, improve our posture and our strength. It helps to improve flexibility, so keep our joints nice and supple. It helps to reduce pain as well. So when we're active, the blood circulates around the body's joints and muscles, and this can help to release toxins in these areas, which helps to improve joint flexibility and in turn helps to alleviate pain. And also it helps to improve bone density. So we know that certain treatments can cause our bones to weaken and sometimes cause osteoporosis. So weight-bearing exercises such as walking can actually help to improve our bone density and also strengthen the bones directly. There are also several psychological benefits to being more physically active, and some of these include helping to manage insomnia. So when we are physically active, our stress levels or the cortisol levels in our bodies actually lower. So this in turn can help us get better quality sleep. It helps to improve our mood, reduce depression, anxiety, by releasing those endorphins or those happy hormones, those feel-good hormones that you might feel when you are active. It helps to improve self-esteem and well-being. A part of that is because sometimes when undergoing a cancer diagnosis and its treatment, control might feel like it's been taken away from you a little bit. So through becoming more active and actually doing something positive and something good for yourselves, it actually boosts your well-being by giving you that sense of control. And also it can help to improve your quality of life. So a few more things that physical activity can actually help you with, more specifically to the treatment that you might have. It actually helps to aid in fatigue management. Now we know that fatigue is something a lot of cancer patients actually experience. And although physical activity might feel like the last thing you might want to do when you feel fatigued, actually doing something can help to boost your energy levels and in turn help to balance out that fatigue. But it's all about finding the right level for you and balancing being active with resting. We know that we can strengthen our pelvic floor and core stability through doing certain exercises, and we know that after radiotherapy and surgery the pelvic floor can weaken in prostate patients and it can do damage to these muscles. So this can then lead to things like urinary incontinence. We're going to talk a little bit more about this in the next few slides and actually teach you some of these pelvic floor exercises. It helps to decrease nausea, and also physical activity produces serotonin, which can help to reduce some hot flushes that you may have experienced as a result of hormone therapy. And finally, some other benefits of physical activity. We've mentioned previously it helps to manage long-term health conditions such as heart disease, type 2 diabetes, the risk of stroke, dementia. And it also helps to reduce recurrence rates in certain cancers. And there's really strong evidence that the risk of recurrence can actually be reduced in prostate cancer patients specifically. It also helps to promote social engagement and helps to boost confidence. So the different types of physical activity. Some of the different things that we may think of typically as exercise or physical activity are things like swimming or aquarobics, walking, jogging, cycling, things like Pilates, salsa or dancing, and yoga. And when we think about physical activity, we think about things that may help to improve our strength, balance, flexibility, and our cardiovascular or aerobic activities. But it's really important to remember that the physical activity isn't just limited to those things that we always think about as exercise. So it's really important not to forget about those hidden activities. So things like taking the stairs, housework, gardening, shopping. We're still using our strength, working our balance, helping to improve our flexibility when we're doing all these things. Sometimes it's it's just about tweaking the way in which we do them in order to get the health benefits. So doing things with a little bit more intent, doing things so that we get our heart rate elevated in order to get those benefits. So the guidelines, we're going to look now at what's recommended for adults between the ages of 19 and 64. It's recommended that we do 150 minutes of moderate intensity physical activity each week. This can be broken down further to 30 minutes on 5 days a week, or broken down even further to 10-minute chunks 3 times a day. So when we talk about moderate intensity physical activity, these are activities that get you breathing a bit more deeply, your heart rate's elevated, you're feeling warmer, but you can still hold a conversation with the person next to you. So these might include things like a brisk walk, cycling, going for a swim, that type of thing. And the daily activities, the kind of hidden tasks that we spoke about in the previous slide, so your gardening, your housework, that often comes into this category. So sometimes it's about integrating your daily activities into this routine and making them count. You'll see also on the right hand side of the screen, it says about doing 75 minutes of vigorous intensity physical activity. Now, we would recommend sticking to moderate intensity physical activity, especially if you're undergoing treatment at the moment. And the vigorous activity is something that you can aim to do later on down the line. These are things like running, going up the stairs quickly, any sort of racket sport that might get you breathing really quickly, feeling really warm, and your heart rate is elevated, and you can't hold a conversation with the person next to you. But like I said, what we'd recommend is just start slowly and aim to get to do that moderate intensity activity first. You'll see in the middle of the slide that it advises that we do some strength training and we work on our strength on 2 days a week. Now, these are things like perhaps going to the gym and actually doing some weight training or using resistance bands. Things like yoga or even carrying heavy shopping bags works on our strength. So it's just making sure that a couple of times a week we do things that can help to strengthen our muscles, bones and joints, especially as we get older. Likewise, a couple of days a week, it's advised that we work on our balance and do activities that help to challenge this a little bit. So it can be things like bowls, dancing, tai chi. But often this sounds like quite a lot to some people. So it's important to remember that these don't have to be separate activities. If we think about Tai Chi or shopping, for example, if you're shopping sort of in a busy supermarket, you're going to be working your cardiovascular fitness by walking around with intent. You're going to be working your strength by carrying those heavy shopping bags. You might have to dodge a few people, so you're going to be working your balance. And, you know, reaching up to the top shelf to get that can of beans, you're going to be working your flexibility as well. So just remember, it sounds quite daunting, but there are some things that you can do to get all the benefits in one. And finally, one key take-home message from today is to minimise sedentary behaviour. So minimise the amount of time you spend sitting down, sitting on the sofa, in front of the telly or the computer. As humans, a lot of our hobbies these days involve sitting and sedentary behaviour. So just think about minimising the amount of time you do this, or just breaking up the amount of time, and just take regular breaks in between that activity. Now we're going to look at pelvic floor exercises. They're particularly beneficial following a prostate cancer diagnosis. Now, if you see the diagram on the slideshow, the pelvic floor muscle is the big blue band running from the bottom of our spine to the pubic bone at the front. It's often described as a hammock because it helps to support all those internal organs, and it has two main functions. So it actually works all day long during our day-to-day function to help us prevent urine from leaking from our bladders. But it also needs to kick in quickly when there's a bit more strain going through that area, for example, when we cough or sneeze. So because of this, we need to exercise the muscle in two different ways. We need to think about working those slow twitch muscle fibres, so doing slow contractions to help the muscle work continuously all day long. And also we need to work those fast twitch muscle fibres, those fast contractions for when we need it to withstand extra strain. So I'm going to talk you through these exercises now, and feel free to practice them with my instruction. And it's something that you can continue doing in your own time at home. So the slow pelvic floor exercises. What I want you to do is start slowly by tensing those muscles. So think about pulling up through your back passage, up towards the front. So imagine that you're trying to stop yourself from passing wind, and then pulling forwards and up as though you're trying to stop yourself from passing water. I want you to hold this for about 10 seconds and make sure you breathe normally. Don't hold your breath. And then relax slowly and make sure the pelvic floor is completely relaxed. So we should be working these muscles every day, and we want to be working them until they start feeling tired, and that's going to be sort of after a different amount of seconds, different amount of repetitions for everybody. So what we'd advise is try and hold it for 5-6 seconds initially, and if you can, build up to 10 seconds, and think about doing 5 or 6 reps as well, and again aiming up to doing about 10. Just listen to your body. If you start feeling the pelvic floor getting too tired, then stop it then. So we want to make sure we have a good quality contraction. Next, we're going to do those fast pelvic floor exercises. So we're going to repeat the exact same action. So join up from back to front, but in a much faster way in order to get those muscles firing quickly. So draw up, hold for about 1 second, and then let go. So you should be doing it at a rhythm similar to squeeze, relax, squeeze, relax, squeeze, relax. So it's quite a quick firing movement, and we want to aim to do this about 10 times. So on this slide you'll see something called the Squeezy app for men. It's an app that's been developed by the NHS, and it's available to any one of us. There's one for women and one for men, and it's a really nice way for people to keep on track of how many pelvic floor exercises they've completed that day, and it can help set reminders to remind you to do these as well. So it looks something like this. You'll have different options to choose from, and if you press the squeeze now section in the orange, it'll come up with your exercises for the day. So it prompts you on when to start contracting, and it'll prompt you to hold the contraction for 10 seconds, and then it'll prompt you to release the pelvic floor as well, so to relax. So the orange section is when you hold the contraction, and the blue section is when you're meant to relax. So it is set at a preset program, which is 10 repetitions with 10-second holds, but it can be amended and individualized, so you can change it if you want to, or if your physiotherapist advised that you change it. After you've done your slow contractions, it'll move on to do the fast contractions. So you'll see in the next box that the orange and the blue sections are shorter, so it prompts you to do the fast squeeze, relax, squeeze, relax, squeeze, relax, like we've just spoken about. Another resource that we find can be quite helpful for our patients is something called the Move More booklet, put together by Macmillan. So in this booklet, it includes an information booklet about physical activity and the benefits, so it can give you a little bit more information around that. There's a goal setting guide and an action plan within this, which can be quite helpful to help you set goals and make it achievable, put achievable goals in there for you. And there's also an activity diary or chart, which can also be a really helpful way for you to make a plan for the week, but also to keep track on how much activity you're doing for that week. So help you see how far off you are of that 150 minutes. There's also a physical activity DVD in there, so there are different programs, one to challenge your heart, one to challenge your balance, one for strengthening, and there are 3 different people working at different levels, so you can pitch it at a level that is suitable for you. The booklet is available to get from the Macmillan website, which is at the bottom of the page here, or feel free to contact our departments and we can send one out to you. So to finish, we're going to go through our top 10 tips for physical activity. Number 1 is avoid periods of inactivity. So avoiding sedentary behaviour like we spoke about previously. Move around regularly, take regular breaks from whatever you're doing. That in itself will help to boost your health. Number 2 is make physical activity a part of your day-to-day routine. Sometimes it's easier to do if you just give those day-to-day tasks a little bit more intense and to get the health benefits. Number 3, it can be helpful to set timely and achievable goals, and using the Move More guide can be really helpful for this. Monitor your progress using an activity diary so that you can actually see written down how you've progressed and what you've achieved so far. Sometimes we don't see those changes in ourselves, so a diary or an activity chart, like the ones in the Move More booklet, can actually be really, really helpful. Gradually build up on your activity levels, so slowly build and work towards the recommendations. So especially if you aren't doing any activity at the moment, start slowly and start doing 10 minutes here and there with a view to build up towards the recommendations. Number 6 is do something you enjoy. You're much more likely to do it if you enjoy doing it. Maybe try a new activity or vary your activities to keep things interesting. And remember, if you do have a bad day and you don't achieve what you wanted to achieve that day, don't be too hard on yourselves, and make sure that you actually reward yourselves when you've achieved your goals. So it's important to acknowledge our successes and reward ourselves when we do well. Number 9, remember you don't have to do it alone. Ask a friend or a family member if they'd like to join you. Or maybe consider joining a group or a club in order to get that social interaction and that peer support as well. So to conclude, we know physical activity is safe during and after cancer treatment. And by making small changes and introducing physical activity into your lifestyle, you can achieve great benefits in the short and long term. Thank you for listening. Good luck with any activity that you do undertake, and make sure you enjoy.